Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hey everyone, and welcome to Raising Parents, the Parenting Science Insights podcast, produced by Ella Massal, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Dina Sargeant. Let's get started. Hey guys, and welcome back to another episode. Now, it gets to stages of parenting where conversations with your child are so important to their growth. Today's topic looks into one big area of eating disorders. We're joined today by the head of the Department of Eating and Weight Disorders at the Villa Garda Hospital in Italy, Riccardo Dalle Grave, MD. Thank you so much for joining me, Riccardo.
Thank you. Nice to meet you. I'm very happy to be here.
It's so good to have you on. Now, to start off with, how did you find an interest in this area of disorders?
It is a long history because it is about 40 years that I'm working in eating disorder. I was a young doctor in an internal medicine unit of the University of Verona, my town, and during that time, we had admission of several patients with severe anorexia nervosa. At the time in Italy, the predominant approach was the family therapy from Salvini Palazzoli from Milan that developed this very famous approach. But I saw many severe and acute patients admitted in the internal medicine unit, and and as a doctor, we had no way to help this patient because we just stabilize the medical condition and refer again to the outpatient treatment. But I saw many patients coming back in the hospital, so I started to be curious because also I remember one of my famous professor, Italian professor of internal medicine, asked to a patient, how much are you afraid to die? And to a young girl. And she said, I'm not afraid to die. And the professor said, well, this patient doesn't understand anything. And so I started to be curious why a young patient is starving, is has a severe low weight, and she's not afraid to diet, and she doesn't see the low weight and the dieting as a problem. So this stimulates my curiosity on this disorder.
Mm-hmm. And do you think that this epidemic has really grown as well through the use of social media and through the use of different ways people are now sort of finding out about disorders?
Yeah, this is an important question. I think this is one we call it in research we call mediator of the mechanism that increase for example, the incidence of eating disorder. It was clear that with the COVID pandemic, we have. I never see my long work with eating disorder in increase of incidence of eating disorder like in the last 3-4 years during the COVID pandemic. And it is clear that it's not just a biological mechanism that increase the incidence, but there are some social factor. And one of these factors is, as you said, is absolutely, I think, social network. We have also some study, both cross-sectional and also longitudinal, that showed a link between the use of some social network and the risk of eating disorder. So it is clear that this is a new problem to address, both from prevention, but we have also how to think, how to change our treatment of eating disorder to include how to help a young patient to manage in a helpful way the social media.
Mhm. And it must be really hard as for parents as well to sort of figure out where this started, what they can do, and also with the lack of resources that, I mean, especially if it's coming up as a more common sort of disorder and it's more becoming well known, parents are hopefully able to find out a little bit more about what they can do to prevent it before it starts to be something every doctor, every parent should be worried about.
Yeah, really, we don't know what to do. It is something that we can discuss. It is clear that it's not a way to oblige the young to not to use social media. There is an agreement that we have to help a young patient to use better the social media. We can discuss what is the age when the young can start to use social media, and maybe it's too early for some young patient to start to use this. But the problem is how to use and how to defend the kids, but also the kids by the social media. Because when you start, for example, I made in my unit a psychoeducational group on how to use social media, and the patient, discussed with me that this is one of the most difficult parts, because when they start to, for example, when the patient, people as eating disorder is really concerned about dieting, food, body weight, shape, and it is clear that is attracted to any news or information about weight, shape, and diet. And when they start to look at this information, they are, completely absorbed and, attached by the information like this. For example, I am a cyclist. I love to cycle, and I'm very happy to use social media because I receive a lot of information about cycling. For me, it's good because I am becoming an expert now. But for a young patient with, with some concern about dieting, about their body, their body shape, this can be very dangerous. So how we can do? I don't know. It is clear that we have to discuss. This is the way I think. It is all the treatment that the strategy we use in CBT, cognitive behavioral therapy for eating disorder, is to involve actively the young patient. Also in the education, discussing what are the risk of using some aspect of social media. On the contrary, what are the opportunity to use social media with another positive aspect. I am against an approach that say you are not to use social media. You have to stop. You have to do this because this doesn't work, in my opinion. I believe a lot in involving the kids in how to defend themselves from some social media and how to use better the social media.
Mhm. No, that's such a great introduction to what we're talking about today. Before I get deeper into it, I'd love to get to know some of your interests and maybe some recommendations as well that you could share with our audience. To start off with, do you have a favorite book that you could share with us?
I don't know because I am an Italian, so I like Italian literature. So I don't know if you know his books because I like Moravia, La Noia is typical. So this is. I also like Philip Roth. He wrote.
Okay.
I think he know better. He's a
Well,
writer.
I definitely should get into Italian literature and hopefully learn a little bit more about it. That's why I love this show because I get to sort of know a whole lot more about different books in different areas that I may not have heard about without this. So no, I definitely am going to look that up. What do you find so fascinating about that area of books?
I don't know. I like the interpersonal, because it is also my work, the interpersonal relationship, how the interpersonal relation create emotion, conflict, and that we gives the sense of our life, this the interpersonal relationship, our emotion, how we understand the others, the world. And so I like the writer that speak about how these difficulties and complex relationship that as a human we have each other, but also beautiful, the aspect of our life, that is so important in my opinion.
Well, that actually does make me want to learn a little bit more about it as well. I think I love the idea of interpersonal connections as well, sort of how that fits into everyday life as well, because we sort of take it for granted in a sense. We don't really know the scientific part to it, but we know that we feel a connection to one person or another, but we don't really look at the science behind how we feel that connection.
Yeah, you're right.
Now, do you have a favorite movie that you could share with us, perhaps?
I don't know. I like a lot Oppenheimer. That's I saw twice the last month.
Oh wow, I haven't
don't
seen
know
it
why,
yet.
but I really like this.
It's on my list to go and watch.
Because
I haven't seen it yet.
It is my interest, because it's a link by science and emotion, interpersonal relationship, conflicts, or what we are doing. I'm doing. I know that I have to do something, but I know that I have not to do this. There is not a right decision, so I like a lot. But it was, in my opinion, one of the best films I saw. Maybe I'm influenced because it is the last movie I saw. I don't know.
Could be.
Could be.
So now, either professionally or personally, do you have a role model or maybe a person that you find yourself looking up to that you could share with us?
I don't know. As a professional, I have many. I was very lucky, because I grew up as a doctor in a period of eating disorder where I had really very, very important person that changed the world of eating disorder. One of my mentors was Christopher Faber from Oxford University. He's a friend, but he's also a mentor, and we have a lot of the similar way of thinking about the eating disorder, but also we like also to spend time together, to travel. We like wine, good wine.
No, that sounds like a really good one. I like that. I like the way that it sort of becomes a professional relationship as well. No, that's really good. Well, thank you so much for sharing some of your interests, and I hope some people have noted that down to be able to find it a little bit later. Now, starting off with, I know that everyone has a very different idea as to what parenting is and the whole idea behind what a parent is supposed to do. Either professionally or personally, do you have a definition for parenting that you could tell us?
It's a difficult question. I am both a father of two. I have two daughters now. One is 28, the other is 23. So yeah, and I am also a clinician that is working with young people and with parents. And I think my way of parenting influenced also my approach in eating disorder with parents. I think that as a parents, we are helper. We need I use the term helper because we have to help the patient to grow up, to develop skills, to address, to grow up and also to address all the challenges they have in their life. Okay, and we need to be role model for our children, but also to to promote her skills, her quality, her gradually her autonomy, and not, you know, and we have to work for them, not for our children, not for ourselves. This is sometimes difficult, but this is what what I think. Maybe we will discuss better, the work in eating disorder of cognitive behavioral therapy and parents later. But one of the uh, distinctive aspects of this approach is that, and that I think it is important in parenting, is to help the kids to to develop their resources to address the life. Okay, not to focus only on the deficit, but on the resources. And I stimulate in my with my daughter and also with my patient the resources to address the problem and the life in general. Okay?
Mhm.
So, in general, I think we need to be helper for our kids to grow up, to address adolescents, to become autonomous in their life, to find their way of living.
I think that's a good point. I think as parents or as a parent, there's that whole idea of you need to be a mentor. You need to be there for your child. And it's a great way of sort of, hang on, let me restart that. I lost my train of thought. um, so I really do like that definition. I feel like everyone has so many different areas when it comes to parenting. There's some parents that think of being a parent as being a role model, some that sort of be as a someone that's meant to tell them right from wrong. But I like that in between definition as well, where it's you're meant to be there to support them, to guide them, but also to make sure that you're there if they do make a mistake, or you're there if you do if they are in some kind of hardship, that they can rely on you. And I think that that's an important part of being a parent, where it's not telling them what to do, but it's also allowing them to know that if they make a mistake, they have you there to help them out.
Yeah, and considering also your your possibility to have the patient, your kids, because as a parents we have our limits, economic limits, and psychological limits, difficulties we have. So we have to try to do our best. It is important not to harm our kids. This is we have to, and sometimes we are to involve more the kids in discussing what to do, how to address the problem, what are the skills, accepting themselves as a human person, and try to 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 take out their skills. Every person has some specific skills, ability, qualities. Okay, and I this is my way of thinking about with my daughters, but also with my patient.
Mm-hmm. No, that's such a great way of sort of building that trust between either you and your daughters and you and your patients, that sort of brings in a whole idea of what being in a profession, what being that professional is, but also what being a parent is. And I think that's great that we've sort of looked into that. Now, to begin, I really do want to start a foundation as to what we're talking about today. Could you define what cognitive behavior therapy is for the audience and for me who doesn't really know the definition for that?
Yeah, cognitive behavioral therapy is a psychological treatment that address mainly the cognition, way of thinking, and the behavior, cognitive behavior that, according to this theory, maintain the problem. And it is important but to not just these two things, on the other things. The focus is this one. You can see it is important however, to underline that there is a generic cognitive behavioral therapy and specific cognitive behavioral therapy. Specific, this is a cognitive behavioral therapy that was designed to address specific problem. And the most evidence on cognitive behavior of this psychological treatment are clinical depression, anxiety disorder, and eating disorder. The cognitive behavioral therapy for eating disorder is a specific form of cognitive behavioral therapy.
Now, eating disorders are something that are really complex to discuss and complex to talk about. What are some key factors contributing to the development of eating disorders in young children today?
If you want a scientific answer, I can say we don't know. We don't know. We don't know the causes of eating disorder. It is, our common understanding is that is a complex illness. When we define a complex illness, this means that derived by a complex interaction between genetic and environmental factors. But we really don't know, even if we made some progress in the last years, the genetics. And we have some data, but not so strong on some specific environmental factor. But we really don't know how the genetic and environmental factor interacts with each other. And this is important. So it is... we need to do more research, and for the moment, and it is what I suggest to the parents, for example, is to take an agnostic position about the causes of eating disorder. Because in the past, we made a lot of mistakes in the field of eating disorder, underlying the role of the parents in determining the eating disorder, and all these theory are not supported by data, and create a lot of problem in the family and also in the treatment of eating disorder in general. Okay, It is clear that I discussed with a caller recently, because in the we had there are periods of interest about the causes of eating disorder. For when I started in the 80s to study eating disorder, there was a many study in the social, factors influencing eating disorder, because we had a new eating disorder. In 1979, we had the bulimia nervosa that was described. There was an increase of anorexia nervosa. So the focus was to understand the social, risk factor of eating disorder, the pressure of thinness, the pressure of control the body weight. But in the last 20 years, the focus was on the biological factor. We have a new genetic study of eating GWAS that identified 8 alteration of single nucleotides associated with anorexia nervosa, for example. But we lost a little bit the focus on research on social, on environment. And as we discussed before, in the last 4 years, it was clear that we had to focus again the research on the social aspect of eating disorder, because we had an increase of 15% in 1 year of the incidence of eating disorder. It is clear that this is not related to biological mechanism, but to some social aspect. We discussed before the social media, and maybe there are many other social mechanisms that we have to study better, because if we understand better the causes, the potential risk factor of eating disorder, maybe we can improve our effort to prevent an eating disorder. But this is now it's still an area very complex and very difficult, and with poor result in general.
Mm-hmm. No, it's a really big thing, because I think especially when you're sort of seeing it socially, and it's become a big social aspect as well, of you see it online, you see it amongst friends and teenagers especially, who are very influential. They're easily influenced by so many other things. They see it as the only option in order to look a certain way, to act, be a certain way. And with the amount of pressure that, and this, especially when it comes to teenage girls as well, that's a big impact on teenage girls, sort of dealing with that social aspect of the expectations set upon by society, looking into that. I wanted to sort of talk about some of the impacts that eating disorders have, whether it's the emotional, the physical, or the psychological impact. What are some of the impacts that can come from an eating disorder in those areas?
This is an important question, because I like this question, because sometimes as a doctor or psychologist, we made a lot of mistake, because we see a lot of comorbidity in eating disorder. We say there is a eating disorder, there is depression, there is anxiety disorder, there are neurodivergent disorder, other problems. What we miss sometimes as a clinician is these features that we see in the patient are a comorbidity or are the consequences of eating disorder. And we know very well the eating disorder psychopathology and the low weight, the starvation, determine not just a physical alteration, but a dramatic change of the personality of eating disorder. I always ask my patient, what changed in you physically, psychologically, socially in your school before, after the eating disorder, after you lose the body weight? And many patients say, before I was a sunny person, I had a relationship, now I am very depressed, I think to the food all the day, I'm very irritated, I am feel of guilty, I am mood swing, I become social isolated, my mood is related to, if I diet, I feel happy. If I binge, I feel very depressed. I'm not able to concentrate at school, to memorize. My life is only on food, eating, shape, weight control. And so it is important to understand that what are the consequences, the psychosocial consequences, not just the physical consequences, because in this case, the approach is to treat the eating disorder psychopathology, not the depression, the anxiety, or the other aspects. So it is what I teach always to my colleague. You have to learn very well the eating disorder psychopathology and the psychosocial effect of the eating disorder psychopathology in the patient.
Mm-hmm. And how can parents sort of recognize some of the impacts that this eating disorder is having on a child? Parents are they can see very well that something is wrong with the child. What are some of the signs that they should look for in order to be aware that something is going on?
It's difficult because there are many presentations, of starting eating disorder, because sometimes are very acute, so it is obvious that you see your kids that start an eating disorder. They stop to eat, they skip the meals, It's an acute onset of eating disorder. On the contrary, it is more difficult when the onset is gradual, and especially in the young kids, sometimes there are some non-specific symptoms that, for example, gastrointestinal symptoms, or things like this, or some, cognitive preoccupation about food shape, weight, but without change on eating, or when you see a young people that is very stressed, or because eating disorder, the onset of eating disorder commonly is associated with stressful situation, transition, from one school to the other, and or some interpersonal problems associated with change of eating behavior, also gradual eating behavior. Parents should pay attention on also if a patient start to, I say, I want to eat better, for example, healthy food is a risk factor for is a precipitating factor of eating disorder. Or, for example, I want to change my diet because I don't digest very well, so I want to digest better, or things like this. These are, something that you have to pay really attention from the beginning. Not every change of the eating should be in young patients should be evaluated by a physician or an expert of eating disorder, because what we know, if we take immediately the problem before, we call prodrome in medicine, it's not just an eating disorder, but there are some symptoms we call prodrome. It's not a complete illness, but just some prodrome. If you take immediately, just sometimes with just education, you can prevent the development of full syndrome of eating disorder.
Now, you were mentioning a little bit earlier about the effects that cognitive behavior therapy has for eating disorders. Can you elaborate on how it is applied to sort of help a child go through an eating disorder and help sort of them understand the effects of that?
I have a little bit to before explaining how the CBT works. I have to give you some information about the conceptualization of eating disorder according to a psychological model of eating disorder. In the field of eating disorder, one of the most challenging questions is to answer why a young people continue to starve, to diet, to losing weight, and not see dieting and low weight as a problem. On the contrary, sometimes they are very proud of dieting and losing weight. In psychological terms, we say that these are ego-symptomic feature of eating disorder, and this is one of the most challenging aspects, because eating disorders are very problematic to see as a problem by the young people, and are very problematic for the parents and from the doctors and psychology to treat eating disorder, because the young patient doesn't see this expression of eating disorder is a problem. So there are two models in general. One, I can say, is a medical model that try to explain this. The medical models say this patient starve, diet, do exercise, is low weight, doesn't see the negative consequences of low weight because they have an eating disorder. They have anorexia nervosa, they have bulimia nervosa, they have another eating disorder. Is a approach that we call also externalization. It's not your fault because you have a disease. You have anorexia nervosa. And this has a lot of implication in the treatment because, for example, this is an approach that is used by family-based treatment or by many multidisciplinary eclectic approach on eating disorder, because the idea is that is the disease that control the behavior of a young, and so the young has no control because it's the disease that control their behavior, and so you have the parents can take the control of the behavior of the young children, or the patient is asked to trust of the doctor, to follow the indication of the doctors. Okay, so it's an approach where the patient is passive, and the parents and the treatment team, take the control of the situation of the disease. There are many pros of this approach because it reduces the guilty, because it's not the guilt of the parents, it's not the guilt of a young, because it's a disease, it's anorexia nervosa. Cognitive behavioral therapy has a completely different conceptualization of eating disorder. It's a psychological conceptualization. So try to, and we explain this difference also to the parents and to the young. First of all, try to understand with a young patient what is the function of the control of eating, shape, and weight. Many times is related to the identity, the over-evaluation of shape and weight, a way of evaluate themselves. Okay, and then try to help the patient to understand what are the psychological and behavioral mechanisms that maintain the eating disorder. Try to understand, in other words, try to help the young patient to understand the ego-syntonicity of the expression of eating disorder according not to a disease model, but to a psychological model, the function, and how and why she is locked in these behaviors. She has no more control according to many psychological and behavioral mechanisms. And this has a lot of implication in the treatment, because in a cognitive behavioral therapy, we never ask the young patient to do something that they do not see as a problem. So the first part of the treatment is completely focused on helping the young patient to reach a psychological understanding of their disorder according to this theory, and then to discuss the implication to address a change, okay, including, for example, the body image, but also the low weight. So it's the young patient that decide to address the low weight, another aspect of eating disorder is not imposed by the others. And the parents are not controllers, but helpers. We can discuss a little more this, okay? So, it is important how we conceptualize an eating disorder. This has a very important implication in the treatment, in the role of a young patient, in the role of the parents, and in the role of the therapist.
So basically, it's a way of sort of rewiring the young individual's mind and sort of understanding on their terms that this isn't how it's supposed to be. This isn't a way of thinking that is going to be beneficial to you, but it's allowing them to make that decision rather than the parents or rather than doctors sort of saying, this is wrong. It's sort of allowing them to be like, okay, maybe I shouldn't be thinking about it like this.
Yeah, he tried to, the first part of the treatment is completely focused in helping the patient to become curious about why he feels so good in controlling eating, in losing weight, what is the psychological meaning behind this. And when we try to understand the eating disorder, it is crucial that we try to explain two things. The first is why it's so egosymptomic. They don't see the low weight and dieting as a problem. And the second thing is why they persist in this behavior despite the negative consequences, physical and psychosocial. So, and the medical model or the disease model, try to give this explanation as a disease. You have a disease. This is the reason. You have no control. You don't understand that it's a problem because it is a disease. This cognitive behavioral therapy try to have the patient to have a psychological explanation of this ego synchronicity and the fact that maintain the eating disorder despite the negative consequences.
Okay.
And according to cognitive behavioral therapy, one of the core aspects we call the core psychopathology is what we call the over-evaluation of shape and weight. In other terms, is a self-evaluation based predominantly on the control of eating, weight, and body shape. And in this over-evaluation, there are many other meanings that we have to explore with a patient.
Mm-hmm. So when it comes to parents, what role do parents play during the process of CBT?
Yeah, it is clear if you follow the cognitive behavioral psychological conceptualization, it is clear that it's different from the role of the parents they have in other approach that they use the externalization. When I use the term externalization, I refer to the fact that there is a disease that controls your behavior. Okay, so in this approach, it is clear that the role of a patient is to help the young patient to approach the disease, the illness, and to take the control of the behavior of a young patient. In cognitive behavioral therapy, and I come back to the approach that I think the parents should have, is the role of the parents is helper, like an helper. In the first part of the treatment is helper in what we call creating an optimal family environment, but also in helping the young patient in understanding the psychological problem and to deciding to address the change. And also during the treatment in helping the young patient to use some specific procedures of a treatment. However, with the previous agreement of a young patient. So in the CBT, the parents never do something that the young patient doesn't agree with. The first aspect is to involve actively the young patient in helping to see this is a problem in deciding, for example, to do regular eating. When the patient agree on regular eating procedures, we discuss with the patient, the young patient also, which help the parents can, and which also with the parents, the type of help they can give to their kids in do regular eating, for example. So, but the parent is not never oblige the young patient to do regular eating. This is the main difference between a disease model and the psychological CBT model of eating disorder.
Mm-hmm. So it's all based on which area that the child or the young individual wants to sort of go down. And when it comes to sort of that decision of themselves, do they get to choose which model they want to follow, or is that mainly sort
Yeah,
of what the parents
absolutely.
decide? Okay.
But it is clear that the parents need to decide. Okay, I'm in my unit. I only applied this psychological approach. So in most of the time, I am contacted firstly by the parents. I describe this approach to the parents, and if they give us also few weeks, 2, 3, maximum 4 weeks, to help the kids to the daughter or son to understand, to have a psychological meaning about the eating problem, and to evaluate the pro and cons to address the change. Okay, and if the parents agree, we we discuss with the parents, and but also with the young person, the difference between the disease model and the psychological model of CBT, and we discuss explicitly what is the different role in the disease model of the patient, of the parents, of the psychologist, and of the doctors, and in the psychological model. In the psychological model, we underline that it's crucial that the patient become active in the treatment, active firstly in understanding the psychological mechanism of the problem, then active in taking the decision to address the change, and active during the change. Okay, and parents and therapists are helper, collaborator. Is a collaborative approach. Okay, it's not an approach that prescribe change, but help the patient to see some problem as a problem. Sometimes it's difficult, and help the patient to develop strategy and procedure to address the change.
Okay, so it brings together a conversation that in a space where
Yeah,
that conversation is not something that's normalized within the household, but it does sort of bring an area of where both the young individual and the parent get to have those conversations as to how they would both like this situation to go.
yeah, it's what can I say? It's explaining the difference to the parents and to the. It is important the difference between the two models to the parents and to the patient, young patient is crucial because it is clear that it's completely different the role of the parents, of the patient, of the therapist in the treatment. And I have to say that many parents and also, but especially many young people with eating disorder like this approach because they feel in control. They like also to have a psychological explanation of the meaning behind the diet and the control of eating, of body weight and shape. And also, another important difference is that in the disease model, you work on the deficit of a young patient. The patient can't eat because it's a disease, it's anorexia nervosa. Okay. Here we stress the resources of a young patient. You can understand, why it is difficult to see your diet as a problem, but you can also understand that it's problematic and to become active and try alternative in develop a good self-evaluation. Okay, so we try to stress and to potentiate the resource of the young with the help of the parents and with the help of the therapist. Okay, so it's a collaborative approach.
Now, this leads us to the next part of the show, which is the practice and habit section. Now, what is a practice that you recommend for parents who are wanting to guide their child through the CBT journey and sort of going through the harrowing journey of eating disorders, do you have any advice for parents that you could recommend?
Yeah, it is clear that these are just general advice because when CBT we meet along the parents, we try to understand what they think and they know about the eating disorder, what is the reaction to the eating disorder, the behavioral psychological expression of a daughter or son with eating disorder. So we try to be very personalizing how to give suggestion on how to address this difficult situation for the parents, to try to help the kids with eating disorder. However, there are some general, advice that I can give. Well, the first is what we call general advice is to create a optimum family environment. And this means, the first, I think, aspect is to try to develop a warm and functional communication style. We know not only in this cognitive behavior therapy with eating disorder, we know very well that to have a hostile communication, a critical communication, or over-controlling approach to the child is associated with poor outcome. So it's a reaction that is not helpful for a young patient. So it is better to adopt a warm and functional communication, with the young patient, to try to support, to be empathic on the difficulties, but at the same time to be firm when the young patient decide to change, to try to implement the procedures of the treatment. Mm-hmm. We also discuss with the parents to try to spend what we call stress-free time with your child, not just focus on food, the eating problem, but to spend time together in a supportive atmosphere, share positive experience and emotion, to practice pleasure activity together with the daughter or the son with eating disorder, not just focusing on the problem. And also I think is taking time. We suggest to the parents taking time for you and asking for support, because eating disorder is a long journey, is a marathon, and as a couple, the parents need also time for themselves. Sometimes it's very difficult, and they need to have some free time and to ask also support for others. Is it possible? Okay. Mm-hmm. Then we also discuss, for example, if in the environment there is something that the parents can change. One of the problems sometimes is one parent is dieting, so we discuss how to address this problem, because dieting is a problem in the family, or other problem, address comparison eating, or trigger communication that trigger the importance of body weight and shape, or mm-hmm. Avoiding also what we call resurgent seeking behaviors. Okay, and also to create a support environment that is not stressful, is it possible, and is not it doesn't increase the preoccupation about shape and weight. Also to protect the young patient, for example, during on special days, Christmas, other parties where there is the pressure of others to eat. And last, we discuss, this is sometimes a big problem, the logistic and other barriers, work barriers, that, are very common in parents with eating disorder. So, however, these are just general indication that we have to personalize we discuss together with the parents how to create an environment that can be helpful for the young. Yeah.
So it's not good to make every conversation about an eating disorder. Every single time you're talking with a child, you don't mention it every single time.
No.
Okay.
It is important to spend, we call stress-free time, to do other things. Okay, we can. First of all, it is important also to encourage the young to speak with a psychologist of the eating disorder or with a doctor. Okay, and supporting, in a calm way, to say that I know that it's difficult. I appreciate your effort to address. I understand that you are so, you have so this negative emotion. Sometimes it is difficult for the parents because, as the parents, we have to educate our children on the behavior, okay? And eating disorder, is associated with very dysfunctional behaviors, okay? So it is almost impossible for the parents not to become critics sometimes, to say, and to react also in impulsivity with criticism, hostility, but it is possible to understand that these behaviors are not are related to a psychological problem, because most of the time, also the young, when they react so angry, for example, they feel guilty. They feel guilty many times after. So it is, and so, it is a mix to be, empathic on the difficulties of a daughter or son, and but also at the same time to be supportive during the change and to be firm, but also to try to live as a family. There is not just the eating disorder. Okay, we have many other hours to spend together with the young, but also with a couple as a parents, that it is important, to spend time also as a couple together.
Well, thank you so much, Riccardo, for sharing a lot of the strategies that parents can sort of hopefully implement with their child and hopefully open up for those conversations. Now, this leads us really well into the open mic section of the show. This gives you a chance to talk about anything that we maybe didn't get to talk about today, or maybe a piece of research that you want to share with our audience today. Now, in the last minute or so, I'd love to give you the floor and share what's on your mind.
Yeah, if it's possible, I take the occasion to describe a new important study that is in course now in Norway. That is because it is a randomized control trial. A randomized control trial means that we randomize the young with eating disorder to two types of treatment. One is family-based treatment, and the other is enhanced cognitive behavior therapy for young people with eating disorder. This I really thank Owen Rowe. He's a professor of psychiatry at the University of Oslo, because he had a grant of €2 million to do this research that is delivered in the 4 regions of Norway, in eight clinical service for young with eating disorder. And the family-based treatment is supervised by Dina Sargeant. He's one of the maximum international experts of family-based treatment. And I'm supervising the a CBT for eating disorder. We completed the training of the therapists that are delivering this two approach, and we have just started the recruitment of a young patient, and I think we will have a data on the result in about 3-4 years. Okay, and the goal is not to see who will win the gold medal. So is it better family-based treatment or CBT? But is to understand what we call the moderators of the treatment, to understand better for this family, for this patient, works better family-based treatment or CBT. We don't know this now.
Mm-hmm.
And so one of the goals is to try to, if it's possible, if we reach this result, to match the treatment to the characteristic of the family of the patient. And I hope that we, at the end of this trial, we will have some more information. I'm very happy for this because in Australia, you are in Australia, some colleagues failed to grant to make this comparison between CBT and family-based treatment. So this is an occasion we have here in Europe, in Norway. Another distinctive aspect of the trial is that the two treatments are delivered in a real-world setting. So they are delivered in a common clinical setting, not in a research setting. So there are not all the bias, the typical bias that we have in the research setting. These are, real world therapists with all the difficulties they have because they don't treat only eating disorder. They have a lot of problems in our clinical practice, and patients that are not selected, all the patients that, require treatment for eating disorder in this clinical service of Norway.
Mm-hmm. No, that sounds like a great trial to sort of understand which of the two options work for different families and different situations that the families find themselves in, whether it could be stress, whether it could be family pressure, social pressure. So that's a great trial to sort of have that we could use and future research and future understanding as to what other pressures, what other stressors are sort of triggering eating disorders, especially if it's something that we're still trying to figure out and we're still trying to understand why it's something that is happening in this day and age. So no, that sounds like a great trial to be a part of.
Yeah. I'm happy for this opportunity. A little bit anxious, because,
well, as all new research does come in, it will be a bit. No, but I'm excited to see how that sort of conclusion comes into and which families it works best for. So, well, good luck to the research. I hope it all goes well. Now, if our listeners want to find out a little bit more about you and some of the work that you've done, are there places that I can send them to, maybe a website or anything that I can send them to?
Yeah, there is a website. We have a CBT website where you can see a lot of information in English, but there is also in Dutch now. We will have also in Italian and in French, and some also in Spanish. And there are information for parents and for the patient and also for the therapist in general on CBT, but on eating disorder, the conceptualization of eating disorder according to CBT, but also there is a possibility for therapists for like training. It's completely free also on CBT. It's developed by the University of Oxford. And so it is, I recommend to go on the CBT website.
Okay. No, sounds good. Now, if our listeners want to find out a little bit more about you and maybe some of the work that you've done as well, do you have is it Psychology Today that we can find you on?
Yeah, you can see, I write in Psychology Today. Okay, there are many articles that I wrote. These are articles for general people, so they're not so difficult to understand.
Mm-hmm.
If as a parent, there are also two books that I print. One are for parents, cognitive behavioral therapy for parents, and the other is for patient. They are published by Routledge, and we use our companion books for the treatment. Because we give a lot of importance of education and what we call guided reading education. We give education on eating disorder, the conceptualization of eating disorder, the strategy to address eating disorder in the session, but after we also ask the parents and the patient to read some aspect of the book. We have also developed some video. For the moment are in Italian. There are some colleagues from Australia that are translating this video also in English. These are educational video on eating disorder in general and the conceptualization of eating disorder on according to CBT, and also there are two videos on how to create an optimal family environment and how to help the young patient to implement some strategy, the CBT strategy during the course of the treatment.
Oh, that's perfect. And we'll definitely have the link down below for anyone who's wanting to access and learn more about some of Riccardo's work, or maybe look at some of the posts that were written as well. Well, thank you so much, Riccardo, for joining me on the show today and for talking about CBT in a way that I think we haven't really heard about before. So it's great to sort of look into that research with you.
Yeah, thank you. Thank you for invitation. I really appreciate this possibility. And also your question.
I'm glad the questions are good.
Very good. Okay.
I hope you guys learned as much as I did when it comes to eating disorders and CBT and what we can do as parents to sort of help support our child going through this. I'll see you all in the next episode. You've been listening to All Together, the Family Science Insights podcast, produced by the Family Science Labs, a division of LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, and other podcasting apps available on your devices. If you enjoyed this episode, please consider rating our show, sharing it, and subscribing to our channel, as it helps other people find it so that we can grow and bring you more quality resources. More of our work can be found on our website at fa.lmsl.net, where you can join our movement. I'm Dina Sargeant. Thanks for tuning in.